Hi, I'm Dr. Suvarchala. I'm the Scientific Director at Vitro Fertility Centers. When we do recommend IVF to patients, especially after all else has failed, one of the most important questions that they ask us is about the side effects of medications. I wanted to talk a little bit about the medications, what they are made of, and the duration of medications for you to bring about a good quality and quantity of eggs, and also the side effects of them. So let's look at what these injections are made up of. You are going to be giving these injections for 10 days, approximately 10 to 12 days is what we are looking at. If it crosses 12 days, it means that the response is not going to be very good and the quality of eggs are going to be compromised. Now, what are these injections basically? Your brain is producing a few hormones called follicle stimulating hormone or luteinizing hormone, and based on the effect of these hormones, the estrogen and progesterone are also released, and that causes the ovulation, formation of the egg and the endometrial preparation, and thereby the embryo will come and implant onto the endometrium, the uterus. So that's the mechanism, and the brain, the ovaries, the uterus, everything is working in tandem with each other to be able to bring about a pregnancy. That's exactly what we are going to do in IVF. We are going to give you the same drugs but made outside. These are called recombinant injections. These are much like what is produced by the brain, but it's in a small dose, isn't it? It's for a single egg to be ovulating. We are trying to grow more eggs here. So recombinant FSH, recombinant follicle stimulating hormone, these are made in a highly purified, sterile condition, and they are to be kept in cold chain from 2 to 8 degrees. They have to be maintained, whether they are transported from Europe or America or made in India, whichever, door to door, they have to be kept in the cold chain. They have to be maintained, because otherwise the efficacy of the injections is lost. So that's the concept. So that needs to be done for 10 days, approximately the same time that you're taking every day. An hour here, there, doesn't matter, because that's what the brain does. It releases this hormone in a pulsative fashion, and that's what we're trying to do by giving the injections externally as well. So you take it for 10 days, and much like our body, when the egg is of the right size, there is a surge in LH, luteinizing hormone, and the egg is ovulated. And we try to do the same thing. We give something called as trigger injection, human chorionic gonadotropin. This will help in releasing the eggs. Yet this is not done to release the eggs. We don't want the eggs released into your body. We want to capture them just before they are released, but to gain the maturity that we are looking at. So just before the eggs are being released, we pass a needle under anesthesia and bring the eggs out from each follicle. So that's the concept of this. And while all this is going on, we also are constantly studying your endometrium, your uterus. Your endometrium should be good. It should be having good supply of blood. The estrogen and progesterone levels in the body should be correlating with the number of eggs that are growing in the ovaries. All that is what we are looking at. While we do that, and the eggs are mixed with your husband's or partner's sperms, and the embryos are being formed, we also put you on progesterone. Now this progesterone helps in good blood supply to the uterus. Blood supply and oxygen supply is basically, you can call the diet for embryos. So that's what the embryo requires. So we also give you progesterone while the embryo is growing in the laboratory. Your endometrium is also growing accordingly by the use of these tablets or injections, whatever is being prescribed to you. Once the embryo has reached the day 5 stage or the day 3 stage, depending on what stage they decide to transfer the embryo back into your uterus, select about 1 or 2 and transfer back into your uterus. You need to continue the progesterone medications, because we want to keep the blood supply on to the endometrium. You need to continue this for 14 days. 14 days later, you will do a blood test. It's a beta HCG to know if you are pregnant. Anything above 80 international units is pregnancy, indicative of pregnancy, and that's after which we decide whether you need the progesterone supplementation, or it can be retracted slowly. We wait for the fetal heart to come 14 days after the beta HCG positive test. So all these things are then fall into place one after the other once the pregnancy is achieved. So the injections and the side effects are very few. You may have a little bit of dizziness, dehydration, a little bloating of the body, mood swings, but if you are aware of all these side effects, you will be able to control them better. Another side effect of these medications is OHS. It is called ovarian hyperstimulation syndrome, where the ovaries suddenly swell up, too many eggs grow up, and it's totally full of eggs, and that's when you get into this syndrome. What we can do is cancel your embryo transfer for that cycle, let everything calm down, put you on medications that will calm down your body, will bring all the hormone levels to a reasonable level, freeze the embryos meanwhile, and transfer the embryos back when everything is calmed down in a subsequent cycle or a subsequent month, maybe 1 or 2 months later. There is no hurry for that, isn't it? So that's another complication, but every complication that I have talked about has a solution to it, and if you are very careful with what dose we give you, duration of the procedure, when we transfer back the embryo, all complications can be bypassed. If you have more queries about the injections or the procedure, please feel free to contact us. Thank you.